Hello, this is Q Williams, RN, and you are watching the Q Williams YouTube channel. Thanks so much. Today, I will be talking about Tavrs, or Transcatheter Aortic Valve Replacement. In the cath lab where I work, we do procedures called Tavrs on patients who have been diagnosed with aortic stenosis. And I'm going to go into detail about that today. Please remember that everything said on this channel is to be used for educational and informational purposes only. This is not medical advice. So, aortic stenosis. Elderly patients can build up calcium and mineral deposits on their aortic valve. Over time, the aortic valve leaflets will become stiff. It reduces the heart's function and ability of the heart valves to open up fully and close fully. When the leaflets don't open as they should, your heart has to work harder to push blood through your aortic valve to the rest of your body. Patients who have developed symptoms from severe aortic stenosis have an estimated 50% chance of living 2 years without aortic valve replacement. Today, there are a lot of treatment options to replace your diseased aortic valve due to aortic stenosis. And if you've been diagnosed with severe aortic stenosis, Tavr, or Transcatheter Aortic Valve Replacement, could be an alternative for you. In the Cardiac Cath Lab, we take a transfemoral approach to Tavr replacement or aortic valve replacement. An incision is made in the patient's leg where a sheath is inserted. The transcatheter heart valve is placed through the sheath and delivered into the person's aortic valve. Clinical outcomes expected with a Tavr. A recent study has shown that patients who underwent Tavr procedures were shown to have 75% lower incidence of death and disabling stroke compared to having open heart surgery. Tavrs may shorten their recovery time of patients getting back to their normal activities, as, like I said, they are normally going through the right femoral artery. And patients may note a quality of life improvement within 30 days. Contraindications to people who cannot possibly receive a transcatheter heart valve, or people who cannot tolerate taking blood thinners. You will have to go on a blood thinner post-procedure to reduce your risk of stroke. If you would like to learn more about transcatheter aortic heart valve or heart valve replacement, please consult with your cardiac physician. Thank you for listening.